Welcome back to another episode of Ironwood Insights. My name is Delaney and I'll be your host. I have radiation oncologist Dr. Davis Romney with us. We're going to be talking about osteoarthritis, what it is, and how we're treating it here at Ironwood.
Hi Delaney, thanks for having me. I'm excited to be here.
Of course, thank you for being with us today. Ironwood has recently been offering radiation therapy for osteoarthritis. So today we're going to be kind of talking about that. But to get us started, can you explain to us a little bit exactly what osteoarthritis is?
Oh, absolutely. Osteoarthritis is a degenerative joint disease that typically happens as we age, where the joint begins breaking down, specifically cartilage.
Okay.
You hear people talk about, oh, doc, it's bone on bone, right? That's what they're talking about is osteoarthritis. You lose cartilage, and that changes the anatomy of the joint. It creates inflammation in the joint, which can lead to swelling, stiffness, lack of mobility. And it can happen in large joints and small joints. Large joints like the knees and hips that people classically think of having a hip replacement, having a knee replacement, or even the small joints of the hands. Think of, the joints between your fingers or in your wrist, and that can affect people's ability to write and to do activities of daily living like eating or drinking. So it can really affect someone's quality of life.
What are the basic treatment options that people have for osteoarthritis?
Standard treatment options for most patients typically would include lifestyle changes like dietary, exercise, weight management, but also can include medications. I mean, classically you think of anti-inflammatories or Tylenol as your kind of basic over-the-counters, but even prescription medications as well. The issue becomes that a lot of times with folks, arthritis can get to the point that those interventions no longer help, or they're not enough to manage the quality of life issues that people have from their chronic arthritis, like the pain and swelling and mobility. How can you exercise and lose weight if you can't walk to begin with, right?
When it comes to radiation, how does that play a role in treating osteoarthritis?
Well, historically, radiation was utilized to treat arthritis even as late as the 40s and 50s.
Okay.
But what happened back then was there were higher doses of radiation that were being utilized at the time, and concerns started to arise about using radiation for benign disease because radiation can cause cancer, and we worry about those risks. And so what we've learned, though, over the years is that you can utilize a very low dose of radiation, and we're typically doing this in patients who are older, where the risk of secondary cancers is much lower. So lower dose, less side effects, lower risks long-term, but it's taken time for us to learn that, right? So right now, this was primarily developed in Europe, specifically in Germany, where it is used very regularly to treat arthritis. And here in the United States, we're kind of new to adopting this paradigm, new to adopting these kind of low-dose regimens to treat arthritis. So right now, we're just not seeing that many patients that could really benefit from this treatment. And so we want to talk about it, to address it, and to kind of go the ins and outs of how it can be utilized to effectively help people improve their quality of life when they have a refractory form of arthritis.
And what kind of patients are eligible for this type of treatment? Is it those patients that have tried everything and it doesn't work, or is it just for some person that wants to just try it out?
I mean, ultimately, we want to use the least invasive intervention possible to treat any disease. So for most patients, we recommend they're working together with their primary care physician. They're affecting their lifestyle changes. They're trying to lose weight and get more exercise. They're trying over-the-counters and then prescription medications. And when it gets to the point of someone who wants to try and maybe avoid surgery, avoid more aggressive interventions, try to utilize something that offers a chance to treat the disease with a non-invasive technique that has up to a 70% response rate in some studies, that's when we really look at radiation therapy, or specifically low-dose radiation therapy, as an option. Anyone who has questions about it, we're happy to see them for a consultation. If their insurance requires referral, they would need to see their primary care doctor first and then be referred over for a consultation. And we always meet with everyone, discuss the pros and cons before undergoing any intervention.
And you don't have to have cancer to come see us.
Oh, absolutely not. And even though you are coming to Ironwood Cancer Centers is because we primarily use radiation to treat cancer, that's higher doses of radiation. This is a very low dose of radiation to treat a benign disease. There are other benign conditions that we treat as well, like keloid scars or heterotopic bone formation after trauma. And this is included as one of the more common benign conditions that we treat with a very low dose of radiation.
Can you explain to us a little bit what radiation is and how exactly that works?
Absolutely. Well, radiation is primarily utilized in this setting to reduce inflammation. And it does that by basically wiping out the inflammatory cells and the inflammatory cytokines that are being produced by those inflammatory cells in the joints. That joint swelling is due to an increase in blood flow that comes from that soft tissue injury. Soft tissue injury leads to capillary dilation and acute inflammation. And radiation can reduce acute inflammation, basically by kind of wiping out those local inflammatory cells and the inflammatory cytokines that come along with them. Thankfully, it's done with a very low dose of radiation that has really minimal to no side effects.
And how long would treatment be for osteoarthritis here at Ironwood?
So a typical low-dose radiation treatment is 6 radiation sessions.
Wow.
Normally for like cancer, it could be 20, 30, even 40 sessions of radiation every day, Monday through Friday. This really long treatment course. With the low-dose radiation, we can do it twice a week. So really it's 6 visits. Twice a week, the treatments take 5 minutes. They're completely painless. Don't feel anything from radiation. If there are any side effects, perhaps you could feel a little bit of fatigue. That's it.
Typical response to this kind of radiation?
So normally folks receive pain relief sometimes after even the very first treatment.
Oh, wow.
Sometimes as little as 1 radiation treatment, they start to feel relief. But for most folks, we typically expect them to see relief some point during the 6 fractions of radiation. Occasionally, it takes a few weeks afterwards. But response rates reported in literature as high as 70%. And these, remember, are folks who've tried everything else and have failed. And so even for refractory osteoarthritis, the radiation response rate of 70% is excellent. Not only that, there have been studies that have shown repeating the treatment for those who don't respond can also still work later on. You don't necessarily, because you failed to respond the first time, doesn't mean that you can't try again a little bit later. And even then, the response rates are still very high, on the order of 60%.
Wow, it sounds like that's a great option for people that don't have options.
Absolutely.
If a patient decides that they want to come in for this treatment, what would that process look like here?
Well, first they would need to be seen for a consultation. And a consultation can be made by calling our office directly or by a referral process from a primary care physician. And that a lot depends on your insurance. Once we see you for the consultation and determine if you're eligible for the radiation, then we would do first what's called a simulation. Simulation is where you come in and we come mark the area, we map it out, we do some calculations, and then usually within 3 to 5 days of the simulation, you could begin the treatment. And that treatment then again is usually twice a week. You come in, you lay on an x-ray table, or if it's your hand, you put your hand on the x-ray table. We have an excellent staff of therapists who help you in that process, bring you into the room, line up the treatments, and help perform the daily radiation. And while they're doing that, then I would meet with you at one point during that treatment process for a visit for a checkup to see how you're doing. After the last treatment is completed, then we would see you back about a month later for a checkup to see how you've responded. Of course, we're assessing that also along the way as we go. But at the 1 month mark, we would expect to have the maximum effect at that point. And then if everything looks good, you would follow up with us as needed as you continue care with your primary care physician.
And how long will people have this relief from this radiation?
It's very individual dependent.
Okay.
For some folks, it's permanent and the pain never really comes back. Now, that doesn't mean that you still don't have joint issues because there is tissue injury in those joints. But usually folks will get 6 months, maybe a year out of it. And then in those patients, you could retreat them again at that point, at least one more time, and expect to still get some significant relief.
And is there anything that patients should be doing to help keep those joints healthy and those muscles? And
Absolutely. But what we talked about at the very beginning are the lifestyle issues that come with osteoarthritis, lifestyle issues like diet, exercise, and it's low impact exercise, right? This is just like walking, strength training, stretching, physical therapy, resting it if it's swollen and inflamed, using ice when needed, and even continuing to use medications to help manage it if appropriate.
Patient that has knee pain as well as hand pain, is that something that you can treat at the same time? Do they need to be broken up into different treatments?
That's a great question. We can treat multiple areas at the same time, so you would come still for 6 visits, but have multiple sites treated. There is a limit to that, however, where just logistically, for scheduling issues, we probably can't do more than maybe 3 sites at a time, with maybe some exceptions for more than that. So yes, you can treat multiple joints on any given day and combine the treatments together and not have to do a 6 treatment regimen and then a month later do another 6 treatment regimen.
And then doing it as, say, 3 different parts, is that still as safe as doing one with the low dose?
It is, because it's a low dose of radiation and the side effect profile is so good, then perhaps there'd be a slightly higher risk of having a little bit more fatigue because you're treating multiple sites, but it's not typically enough to stop us from doing that.
Is low-dose radiation therapy for osteoarthritis covered by insurance?
It is. This is an FDA-approved therapy for osteoarthritis. It is typically covered by insurance. However, you still have to go through process of getting it approved by individual insurance companies, so it can vary from insurance to insurance, but it is typically covered. Of course, your insurance may require copays and things like that, which we would help walk you through before we ever started anything.
Well, thank you so much for joining us today, Dr. Romney, and going over that with us. I think there was a lot of valuable information in that. If you're interested in learning more and if you would like to possibly get seen for osteoarthritis, you can visit us at ironwoodcrc.com or call us at 602-494-6808.